So the CO-1686 is one of the third generation EGFR TKIs. There are a few in development right now. This is one of the ones that's furthest along. There are a couple that are ending phase 1, going into phase 2. And the advantage of the third generation drugs is they're really specific to the EGFR mutations. So they hit the EGFR mutant activating mutations, but also the T790M resistance mutation, which of course is responsible for about 60% of EGFR TKI resistance to the first generation drugs and second generation drugs. So a lot of excitement because there's been activity seen in the first in human phase 1 dose escalation once we got to the higher dose levels. The drug's been reformulated now into this hydrogen bromide salt, and the recommended phase 2 dose has been selected, which is 750 milligrams twice daily of the hydrogen bromide formulation. So currently it's an expansion phase for the phase 1 study, and it's going to then move into a series of different trials looking at either first-line untreated patients, patients who have developed resistance, focusing on the T790M mutant population for many of the trials, but also some that don't restrict to just that group. So I think I've been impressed with the activity I've seen in some of my patients. I think this is a real drug. The toxicity profile has been pretty well worked out, at least to date. We're not seeing a lot of rash or diarrhea, so it's not hitting the EGFR wild type based on the toxicity profile, which is also what was expected, that it wouldn't be hitting the EGFR wild type. We are seeing now some hyperglycemia in the current dosing, and so that's an unusual, unexpected toxicity. We're trying to work out the mechanism at this point. It's easy to manage, you just have to know it's coming and watch patients for that. It's not all of the patients, but enough of the patients, it's something we need to be aware of and we watch for closely. So I do think it's going to play a role. We're going to need to see more from the ongoing trials and the trials in development right now. So it's an oral medication and it's given twice daily.